To begin the PRP procedure, draw 50 cc of blood from the patient into a syringe. Inject the blood from the syringe into 6 blood collection tubes, provided in Adipose PRP kit. Insert 6 blood collection tubes into the centrifuge and spin at a low speed. Using a spinal needle, draw out the clear PRP liquid at the top of the tube and inject into 2 new 15 milliliter centrifuge tubes. Place the clear PRP into the centrifuge and spin at high speed. Discard the red blood cells. Draw out the clear plasma at the top of the centrifuge tube and discard the fluid into a basin. Leave only 1.5 milliliter of PRP liquid in the tube. Using a spinal needle, reconstitute the liquid and add the contents of one tube to the other. Draw out 2 milliliter of the Adipose calcium activator into a syringe and inject it into the tube filled with PRP liquid. Allow the liquid to clot. When the PRP liquid has dissolved from the clot, draw out 3 milliliter of the liquid and discard the clot. To begin the manual liposuction procedure, inject local anesthetic into the patient's abdomen. Next, inject tumescent into the fat layer between the skin and the muscle. Wait 20 minutes for tumescent to take effect. Begin manual liposuction procedure with a 3 millimeter cannula. 300 cc of fat must be extracted from the patient and placed into the Terumo bag provided in the Adipose kit. Draw out the fluid from the fat and discard the fluid into a basin. Wash fat with 50 milliliter of saline solution and allow to stand for 15 minutes. Drain fluids from the fat and repeat the process again. Once more, add 50 milliliter of saline solution, this time also adding 10 milliliter of Adistem's cell extraction medium to the bag. Here we see the cell extraction medium being added. Dissolve fat by massaging the bag for 15 minutes and allow to stand for 15 minutes. Drain fluid into the 15 millimeter centrifuge tubes and discard the bag. The cells are now ready to be centrifuged and spin down. Please refer to the Adistem protocol in your kit for the exact procedure. After the final spin, discard the clear liquid at the top. Combine the cells at the bottom with PRP from the previous step in a 20 cc syringe and activate for 15 minutes in the Adistem LED. Again, please refer to the Adistem protocol for the exact process. The cells are now ready to be combined with a small amount of fat and injected into damaged areas manually or using an ultrasound guided technique.